So I thought we'd start with Ros. Can you describe what integration involves and how important it is?
I'll try. Okay, thank you. So integration hasn't been discussed so much in our presentations right now, and I would say that really for me it's been quite difficult listening to the presentation of psychedelic therapy or psychedelic drugs the way they've been discussed today, because for me, and I think probably I speak for Ian and other people that were involved in the psilocybin for depression trials, you can't separate the drug from the therapy. And you can't separate it from the social container and the culture that we take these or we use these treatments within. So when we're talking about integration, we're really talking about the kind of community that you go back to after a session. And I would say that the drug session itself is a tiny part of the healing journey, especially if it's given in the kind of Western medical setting where you're given a drug and then that's pretty much it. It might lead to some flexibility, window of opportunity, but there is no cure from one drug session. It opens the door to exploring parts of yourself and other people in the world around you, but to do that, it's just opening this door to that container. And I'm sure that most people that have experienced deep healing from this kind of work will have experienced it in that kind of framing. So the integration, it's not just a kind of add-on of you have a session, your mind is healed, you're no longer suffering from depression, and then you have some follow-up work to kind of consolidate it or optimize it. I think I would suggest that we have almost that we might offer a very different way of understanding the whole thing. So integration is the culture, is the connection, is the humanity, and often after psychedelic experiences, people have their symptoms return. I would say on average of all the people I've worked with, it's kind of a couple of weeks, really, or months, where the afterglow starts to fade, and that's when it's all about the integration therapy, and it's no longer about a kind of brain change. But I think Ian would probably add a lot.
Ian, I think you've experienced integration. Can you just describe to the audience what that meant for you?
Well, first of all, I'd just like to echo what Ros has said. These are catalysts, not cures. It's not like you take them and then you're fixed. I think that's a very, seeing them like painkillers is not the way forward with these treatments at all. And myself and PsyPAN co-founder Leonie, who's just over there, I think we're testament to the fact that these treatments aren't cures, because we've both taken part in 2 trials each already. So it really is about taking, the psychedelic experience is very important, I would still say. So I'm not sure how I feel about the drugs where that's taken out, and I think there's a discussion about that at some point today. It's very valuable to dive in and to have these epiphanies and these realizations, but it's what you do afterwards that's the most important part of the whole process. Otherwise it's like going on holiday to the south of France and then you go back to being an accountant in Croydon. If you don't make those changes to your life afterwards, while you have that plasticity, while your mind is still open to these changes, these sustainable changes, then it's almost like
what did you actually have to do?
You lose the benefit. So what did I have to do? Well, I was lucky after the Imperial trial to have an afterglow, and that's not guaranteed. That must be said as well. And I felt I was depression and anxiety free. I felt more connected to nature, but there was no onus on integration back in 2015 when I did the pilot study. The Compass trial that I took part in 2019, my depression and anxiety came back as the drug was wearing off. So again, no silver bullet there. But there was more onus on integration. So I joined the Maudsley Psychedelic Society integration group, and by doing that, that helped me to process a lot of things. And then thankfully, just after the pandemic kicked in, Ros came along with her connectedness program, which she ran with Synthesis and has now evolved into the ACER program now. And that's involved being out in nature, lots of different connectedness exercises, but then also connectedness between the community. It's all been via Zoom calls, but the group that we have is that the bond is so tight, so close, you know, and that's been, I think that's saved all of us in the group during the pandemic, to be honest.
And have you received therapy as well, or has it just been a peer group?
Yeah, that was one of the criteria for being part of the group, was that you were still in therapy. So it's not as a replacement for therapy. It's to, you know, if you end up in crisis, you know, that wasn't the place to hold that, sadly. You know, it couldn't do everything. So you still needed to have a therapist that you could turn to if things did nosedive. But generally, when things were dipping within, I don't know what normal parameters are, but having struggled with depression for most of my life, but, you know, within a certain range, you know, we would all carry each other through those moments, and you would see people one week, you know, you were the one that needed the help, but a couple of weeks later it would be, you know, another member of the group. So.
And what's been, let's start with the best and then move on to the worst part of your experience?
My experience overall.
Of maybe integration, if we're focused on that today.
I think the best is being able to tap into those. I remember after the Imperial trial, and there was no onus on integration, but it was something I still do to this day. I was drawn to nature. Nobody told me go out in nature. I was drawn to nature, and round the back of Imperial there's Wormwood Scrubs. So I went straight out there and just feeling the soft earth under my feet. I was hyper aware still, extremely sort of mindful state. And that was amazing. I still do that to this day. Every now and then I check in, walk on the grass, and feel the earth under my feet. And that all went really well until I got attacked by a swarm of horseflies. And I was like, am I still tripping? And I was like, no, I'm actually in serious pain here. So, yeah, maybe that's the best and the worst. I don't want to be too... Yeah, the worst is when you feel it fading. That's the worst. And you're like, I can't access that anymore. And you try. And that's where integration is vital. It's to keep reminding you of it, which is why, you know, it has to be an integral part of these treatments. And that's, you know, a huge reason why we've created PsyPAN, is to work with people in this room who may not even think about integration, may not, I mean, I hope you all think about participants and patients, but, you know, a lot of the time, you know, there are things that people just aren't thinking about, you know.
And Rory, you've had a slightly different experience. You weren't in a trial. So maybe if you could touch on your experience with psychedelics and then move on to why integration was important to you.
Yeah, okay, well, when I finished my rugby career, I had, hit an absolute health crisis, injured prematurely, and basically from antibiotics, my digestive system stopped working, my leg break wouldn't heal, and so I was stuck in this rut, slipped into this depression, mourning the loss of my career, my lifestyle, all my friends and all that kind of thing. So huge emotional trauma as well as dealing with this kind of physical trauma that was going on. And I soon slipped into a pretty heavy depression. And for a year or so, a year and a half, I was stuck in a depression with suicidal ideation, lost all hope, couldn't see a way forward with my life. And I was looking for some kind of intervention. And I heard a powerful testimonial about the plant medicine iboga. So 2 weeks later, after hearing this testimonial, I was out in Costa Rica at a retreat center, and I had 3 ceremonies with iboga. And it immediately turned off the cycle of negativity that I'd been trapped in my mind. Hope, and hope for moving forward with my life. I kind of had a blueprint for how to navigate the challenges that I was facing. It's like my perspective was elevated to, a high level, so I could see my way round and through everything that I was facing. And like Keith from Heroic Hearts, I had gone through a complete life review and understood the roots of my trauma and dysfunctional behaviors and all this kind of thing. So it was kind of, for me, it did feel like a kind of a rebirth in this moment. But it was a real important part of my journey, so working with iboga, but also with ayahuasca, is being because I've been outside the clinical setup, I've been in ritualistic settings, working with indigenous tribes. The connection that you feel in the ceremony when you're surrounded by other humans, other people who are either going through the work as well, doing their own healing, or you're being supported. I guess, you know, the indigenous tribesmen and the shamans are almost like the therapists. And to be held in that container, surrounded by love and support, is such a key part of working with these medicines. It's the connection that we feel to ourselves and to others and to Mother Nature. That's what causes the healing. And so the difficult part for me with integration from these experiences was having these transformational experiences and then coming back to my home life, connecting with, trying to connect and express myself and speak about the experiences that I had and all these revelations with my partner at the time and with my friends, and just being met with kind of skepticism and just there's always kind of a blockage. What I found was the people close to me in my life just weren't receptive to or being open to what I had experienced, and I could feel that, and it's really jarring in the moment when we don't have support around us. We go through these incredible experiences where we get all these unbelievable insights, and we, you know, the ceremony is just, or the connection with the medicine is just the start. We have to, we have to integrate and embody all the insights that we got, and it's tricky because we want to be able to express and speak, but if we're not being met by our peers or family around us, it can feel quite isolating, and it can almost, it has the potential to, bring back depression and that feelings of loneliness and isolation. So, for me, it ended. That was after iboga, it was the catalyst for the separation with my partner at the time, because I had new thought patterns, new behavioral patterns. I wasn't interested in the same things and was moving forward in a different way in my life. And so it can create this kind of separation from those who are around us, and to go through that process on your own is tricky in itself. So yeah, it is so important, this connection that we have with others who understand what we've been through and what we're going through.
Yeah, I think you shared some really powerful points there. And I'm just really intrigued, what has been the response of the rugby community?
Yeah, well, I've on my path of healing and working with these medicines, I really had to step outside the rugby bubble. And to be honest, my health condition alone just kind of had to like park my previous life. But whenever I have had like communications with the rugby community, first of all, I'm very careful with who I disclose it to, just because there's still a huge amount of stigma around these medicines and huge amounts of ignorance. And so, most my ex-colleagues, they're just completely closed off. They kind of think it's extreme and out there or wacky, or and so a big part of the work that we all have to do is to normalize these medicines. And as Keith mentioned earlier, testimonials, I think, is the thing that really connects people and opens people's mind up. And this is why I'm here sharing my story, to hopefully bring awareness to the power of these medicines.
Yeah, I was going to ask you, what do you say to the people that think that you're wacky?
Well, it's trying to bring them to the awareness that these medicines can actually help us get to the actual root of our suffering. So much of the suffering comes from the trauma we've experienced in our life, and the feeling of disconnection from ourselves, from our family, from friends, from our society. And so, the message I give to people about these medicines is that they help us get to the root cause of our suffering, and also create a sense of connection to ourselves, to Mother Nature, to a community. And that connection is what really brings about the profound healing. Certainly that's what I've experienced in my case.
And Ros, what are the risks that people need to be aware of?
In terms of
taking a psychedelic, maybe not having the right integration, because I guess it's a very fine line between having the right and wrong, like that's arguably maybe one of the most important aspects of the experience you said earlier. So
yes, yeah, it's difficult to find. I was interested, did you find integration support? Did you have a integration therapist or?
No, there was no therapist. The only support that we had was, through the WhatsApp group, through the individuals who had also gone through the ceremonies and the ritual, the healing together. And that was basically the lifeline that I had, but it still probably wasn't quite enough. And so went through some difficult challenges post experience.
Yeah. It often, I think people often feel very raw afterwards. So even if, I think one of the challenges, as Ian mentioned, is that for a lot of people I've worked with, nearly all of the people I've worked with over 5 or 6 years, have had a very disappointing crash when they hoped that they were going to feel kind of depression-free or at least, much reduced symptoms for much longer. So I'd say that's probably the most common kind of challenge afterwards. And then in terms of finding integration support, you're looking not just then for support with integrating the actual psychedelic experience, but also support with managing that huge disappointment. So there's disappointment when it fades, and then there's also when it has been effective, huge sensitivity and often big life changes. So people often in the months afterwards or weeks afterwards will make big changes to career, relationships, things like that. And you really need some reliable support there from people who can be a sounding board, make sure that this is,
And I understand that ACER Integration is mostly an online platform. So how do you have safety nets in place to ensure that people are safe in their own homes?
So it's not a therapy. It's not a substitute for therapy. So it's a community that's mostly online, but it does have in-person elements as well. But it's really important that if people are suffering, if they are going through mental health difficulties or going through any kind of things. I mean, it's a very inclusive group, so it's open to people who are managing addictions. We don't say no to people in the same way that many kind of therapy communities have to. Because it's peer support, we can be much more inclusive and open, but with the caveat that if you need help, please get in-person help from a professional.
And just to wrap up, so Ian, what do you think that the ideal future of psychedelic-assisted therapy and integration would look like?
If everyone doesn't mind skipping lunch, I can cover that in about an hour. But my main hopes are that we can help organisations to ensure that it's basically covered by psychedelic safeguarding, so that every step of the trial or the treatment it just puts the participant at the heart of everything. That's vital, and there's so much that can be learned, and that's why we're collating different voices, different people that have been through these trials, bringing all of that together to create this feedback loop, to keep feeding in, helping organisations to keep creating better and better and better trials. So that's what I hope on that level. Secondly, I really want to see more marginalised groups included in all of this across the board. Medical trials are very... There's zero diversity, really, in medical trials, and I hope that doesn't carry over to the treatments afterwards. There's a lot that needs to be addressed there as well, because as we know, marginalised groups struggle with mental health problems more. On the integration level specifically, I want to see programmes like Ros's, basically. I want to see that long-term support put in place for people that are coming out of these trials, because there is that sense of abandonment, there is that sense of being lost. And you go from being isolated as somebody struggling with depression to being isolated as somebody that has been through this wacky experience, and can't speak to anyone about it,
Thank you. I think that's all we have time for. Hope you're not too hungry and enjoy your lunch.
Thank you.